The first component of my daily regime is my pills. As you see in front of you, there are 13 different types of pills that I take. I generally take them once or twice a day. However, the ones that you see on the left are pills that I take every single time that I eat. To help me be more organized, I set my pills up a week in advance so I can just pop it open and take it when I need to. The first important part of caring for my diabetes is testing my blood sugar. I've laid out the amount of lancets and test strips that I need a day because I test an average of 6 times a day. The next thing is my insulin pump that I wear. I have to change it every 2 to 3 days, and these are the supplies that I need to change it. I also wear the continuous blood glucose monitoring system, which is represented over here. I have to change that every 2 to 3 days. Part of caring for my diabetes is making sure that I have good control over my diet. So these 3 white pieces of paper here represent the amount of times a day that I'm allowed to eat carbs, 3 times. These pink pieces of paper represent the amount of times a day that I'm supposed to have carb-free, high-fat, high-protein snacks to help me gain weight because of my CF. These are some examples of some low-carb or no-carb snacks that I eat. The most demanding aspect of my day is represented by all that I need to do for my respiratory care. So these are the medications that I take daily from a respiratory standpoint. I use a breathing machine to inhale these 3 in addition to 1 antibiotic. This compressor here takes an average of 10 to 15 minutes to do each of those medications. So a minimum of 30 minutes and a maximum of 45 minutes to do those 3. And then depending upon what antibiotic I'm on, dictates what machine I use for that. This machine can be used for my colistin in this neb device. This machine is used for my castin, which is about a 3-minute treatment, the shortest of all. And this machine, which yes, is different from this machine, is used for my tobramycin. After doing breathing treatments, it's necessary for me to engage in airway clearance. These are 2 examples of airway clearance devices that I use. The one on the right is called the electroflow. It is an old-fashioned chest percussor that pounds on the chest with a lot of force to break up plugs. This right here is my vest. I wear it, buckle it up, and hook it up to a machine that fills up with air and vibrates to break loose all of the goodies in my chest. I need to do at least one of these devices 20 minutes twice a day. Another form of airway clearance that is not shown here is exercise. Just anything from walking, jogging, swimming, even surfing could be considered airway clearance. Another demanding aspect of my day is all the stuff that I need to do to maintain my sinuses. I need to do nasal irrigations at least twice a day. I use the NeilMed sinus rinse with saline. And then I do an actual nasal nebulizer. I mix my 2 medications with saline and hook it up to this machine, similar to a standard air compressor. And I put it in my sinuses. It takes 5 to 10 minutes to administer a treatment. I also use a nose spray twice a day. The end of the day is usually the time when I wash my treatments. I take the dirty nebulizers that I have throughout the day, put them in a bowl with hot water and a couple of drops of dish soap, let it soak for 30 minutes, and then rinse them off, put them in my steam sterilizer, fill this cup up with distilled water, dump it into the steam sterilizer, and it takes about 6 to 8 minutes to sterilize. And then I set it out to dry on a paper towel to be ready for the next day. Sometimes during pulmonary exacerbations, I require an additional component to my daily regimen: IV antibiotics. Right now, I am doing IV antibiotics. I'm currently on 2 different medications, and this is all the supplies that I use for 1 day. I take 2 different medications. This one is every 8 hours. This one is every 12 hours. This medication takes 5 to 10 minutes to infuse, and this medication takes 90 minutes to infuse. So as you can see, there's a lot that cystic fibrosis patients need to do every day to care for themselves in the best way possible. I hope this video has helped you understand more of what an average day for someone like me looks like.